This is a short algorithm for preoperative evaluation of ischemic heart disease for non-cardiac surgery. So let's work our way through the algorithm. First, if it's an emergency procedure, meaning that within 6 hours you'll have loss of life or loss of limb, you should immediately proceed to surgery. Otherwise, if the patient has had acute coronary syndrome now or within the past 60 days, that's an MI or an unstable angina within the past 60 days, you should postpone surgery, and there are guidelines to help you manage this case. Otherwise, if the patient is low risk for major adverse cardiac events, and there are a couple risk calculators for this, then you can proceed to surgery. So not an emergency, no ACS, and the patient is low risk, you can go ahead to surgery. If the patient is high risk, and then you need to look at their functional capacity. If their functional capacity is greater than or equal to 4 METs, you can also proceed to surgery. If you don't meet any of these criteria, so if the surgery is not an emergency, no ACS, but the patient is high risk and has low METs, then you need to do a cardiac evaluation with pharmacologic stress test. If the stress test is negative, you can go ahead and have surgery. If the stress test is positive, then the patient needs coronary revascularization.